สวัสดีค่ะ Good afternoon. So, welcome back to Tea Talk Live webinar once again. And today I'm Ying Nanhawan Siputra, working as a Customer Relation Management Officer. And I'm here today with Dr. Kanya Temkiatvises. She's the Director of Neurology Science Center. So, glad to welcome you all back. And the topic of today is very important because I believe everybody sleeps every night, but we are here and talking to our doctor because so many people having problem. They feel like they are sleeping all day long, but all day. I mean, during the period of COVID-19, maybe many people have plenty of time to sleep, but the quality time is very important. So we are going to talk about sleeping problem, whatever, but if you have questions listening to our doctor, so please be prepared. You can type, you can write your question, and our doctor will answer your question that you may have. And I have to say we are here with our expats who are living on Phuket Island and the nearby provinces. And let me ask you, doctor, you're the director of Neurology Science Center. What kind of service do we have at that center, please?
Okay, our center, we have the services like general neurology disease, headache, stroke, dizziness, Parkinson's disease, dementia, and including sleep disorder.
Yes. Oh, talking about sleeping, as I just mentioned, during this lockdown period, many people have to work from home and they are staying at home and maybe cozy, lazy, easy life at home. Yes, yes. But sleeping too much maybe is not kind of quality of life. Yeah, I heard that if we don't have enough sleep during the nighttime or we don't have quality time of sleeping, it may also cause us problem with our health. So what may happen? Like what kind of problem that may happen?
I think we think about like 24 hours a day, right? How many hours that we sleep at night?
When I was young, it's like 8 hours.
Yeah.
But that's very old information. I'm not sure it's still like that or not.
Yeah, it's not equal for all people.
I see.
We use like normally 6 to 8 hours during the night for sleep. But it's not just the duration of the sleep. The quality of the sleep is still important. Because even you sleep 9 hours, 10 hours, but it's not good quality of the sleep. How do you get deep sleep, right?
Oh, it doesn't mean that if we go to bed at 10 o'clock and sleep until the next morning, that we have enough sleep, right?
Yeah, it's not enough. I mean, it's not the one factor that we need to meet. It depends on how deep of your sleep also.
Oh, how can I know? How can I see? Especially for those who are sleeping alone.
Normally, it's quite difficult to say that you have deep sleep or not. But you can see the effect in the morning that you feel like a morning headache. You feel like you sleep 10 hours already, but feel tired in the daytime. Or when you're waking up in the morning with any dry mouth or dry lip. This is a one factor that maybe the night that you sleep is not enough.
So everything sounds like maybe, but like I think and I believe, but it's not a fact, right? I learned and I thought it's the fact, but actually I think now since I'm here with the expert, dry sleep, sleep or wake up with dry lips, I feel like maybe I open my mouth the whole night, or I snore a lot, and I feel like someone said I snore a lot, like they are sleeping with the long tail goat. So that means deep sleep. I thought maybe I'm not right, and wake up again but still tired, maybe too much work overload, or maybe because of my body weight. So I think it should be like there is the way, or there are some ways to find out.
Yeah.
To get the answer, right?
Do you know sleep apnea? Have you heard about it?
I myself, I have to say, frankly, I'm the patient of Dr. Kanya, and I got the test done. Thank God. In the past time, as I mentioned to the audience before, I heard from my friends, sometimes I have visitors. I have friends who come to visit, and we sleep together in the same bedroom. So they said that I snore a lot. And I feel like maybe I was tired during the day, and I sleep like deep sleep, so I snore. And after that, during the time I work and I'm talking or sitting in the meeting room, I fall asleep and I cannot drive, even the short distance, like from Bangkok Hospital, Phuket to Wachira Hospital, it's just like 2 kilometers, but I cannot make it. I feel like I will fall asleep. And I consult with the doctor, and she said, I need to do the sleep test. And I've got the test done, and I find out that I have to take care of myself, but not just sleep longer, but I have to use the machine. So I would like to ask you, and maybe you can share more information about, after we got the test done, what kind of treatment that our hospital offers.
I'm talking about the sleep apnea because it's the most common form of sleep disorder.
Yes.
That is happened, and most of the people that you said, snoring is just deep sleep, feel tired or because of your hard working. But in fact, it's not. It's not all.
Thank God. I got the answer.
Snoring is just one symptom of the sleep apnea. Apart from that, like some people can feel like a restless sleep, like sleep and turn.
Okay.
Or going to the toilet many times during the night.
So it can be.
This is the one symptom. Or like if you sleep with your partner can say that, oh, why you snoring like a long tail?
Sleeping with a long tail board.
Or stop breathing during the night.
Oh, that's scary.
So it seems like this symptom I think your audience feel familiar with this symptom also, right? Because sometimes we're talking about this one a lot.
When you talk about stop breathing, I feel like it can be like this kind of sickness can be like a killer that stay with us every night in the bedroom. So
because if you see the picture, it's related to many diseases. Heart disease, high blood pressure, memory problems, stroke, dementia, depression, obesity.
What's before, what's after, I'm not sure.
Right?
Maybe obesity caused sleep apnea, or sleep apnea caused obesity.
Like many people with the sleep apnea don't need to be obese. Someone really thinner than me.
That can also have this kind of sickness.
Sleep apnea. So it's not only the body weight. It depends on many factors.
So body weight can be one of the factors. But even you're not overweight, you also can have this kind of sickness. Right?
And when you're getting older, this sleep apnea normally can be worse and worse. What is the cause of the sleep apnea? So we have to see the anatomy. We think like easy way, like it's come from airways inside your throat.
Okay, because of the airway.
In normal, I mean, when you're awake, you still have muscle tone inside, right? So you can breathe, everything all right, normal. But when you sleep, have you ever fall asleep in the daytime? Because that one, when you sleep, the muscle tones, you loss of the muscle tone.
I see.
It's the same as inside your airway.
I have very short neck.
Short neck is the one factor.
It's also one factor. I already have 2 factors.
So when you have narrow airway and you sleep, you loss of the muscle tone, it's become collapse. If collapse a little bit, make the snoring sound. If more collapse, the oxygen inside your body is not enough.
Okay.
Even finally it's collapsed all, totally blocked.
Oh.
What happened?
Then maybe I feel like drowning, right?
Yeah, you try
But
to breathe,
Mhm.
you try to breathe, but cannot because this one is blocked. So
Oh.
finally, your brain know that, oh, low oxygen already.
Oh, that's why
What
they
does he do?
the silent killer.
Yeah, so you have to wake up,
I
and wake up.
see.
So how you can get deep sleep? Because you're gonna go to deep sleep.
Yeah.
Gonna go to deep sleep, right? It's just like sleep whole night long, and make low oxygen to your body.
Yeah.
Yeah,
I
to
also
your
heard
brain.
from the technician after the test done, and I also got the explanation from our doctor as well. What they told me is like, I fight to get the oxygen
Mhm.
the whole night, because during the daytime we don't feel that we don't get enough oxygen, because when I walk, I keep breathing all the time. Yes, but in the night I don't know that. I cannot realize. I cannot check myself, but I don't know that I'm struggling trying to get the oxygens. And I think if I don't get enough oxygen in the night, maybe it's also cause the problem the next day.
Yeah,
The quality, not quality sleeping, then it's
Yeah.
not a quality working hours or
yeah.
time.
And
as
why
well.
you feel like sleepy in the daytime?
Mm-hmm.
Because of like you it's like you didn't get sleep at night.
Then
You still feel sleepy, right?
Yes.
Yeah. So the sleepiness in the daytime is not only from hard working. This one is the most common symptom and disease that cause it too. Yeah, we
Sure.
call excessive daytime sleepiness. Yeah.
Okay. So I think then we have to focus about our health. We are dealing this period of time. I think living healthy is the most important time, the most important thing dealing this period of time. If we have friends who we have chance to sleep next to them, and we feel, or our loved one, of course, our loved one, and if they're snoring, so we cannot ignore that, right?
Yeah.
We should not ignore that. Or if someone feel weak or tired without any reason, and also drowsiness during the daytime, yeah, dealing the boss and the workers or colleagues, I think we have to focus about this, and maybe we have to discuss about sleep test, right?
Yeah.
Mm-hmm.
The way to we get diagnosed that you have sleep apnea or not.
Mm-hmm.
Because it happens when you sleep, right?
Yes.
So how do we get diagnosis? We have to do the sleep test.
It's not enough if we just order someone to sleep next to us and observe.
Not enough. Because
I see.
when you just observe, you can hear,
Uh-huh.
right? But you don't know anything else.
Okay.
But if we do normally the standard, we call gold standard of the treatment of the diagnosis is overnight sleep test inside the hospital.
I have done that before many years ago. After I discussed with our technicians and our doctor, and they invite me to come in, and I stay like after 8 p.m. and there is a technician stay overnight, but the technician is observer like in the other room.
Yeah, you not sleep alone. You still you
Okay.
sleep alone inside the
The
private
bedroom.
bedroom.
Yes.
But the technician, our technician will help you. Even if you feel like going to the toilet, that can help you, but they let you sleep. Yeah.
I feel very comfortable that night.
Yeah.
I have to say it's the best bedroom.
Yeah, because how different between you observe yourself at home and sleep test inside the hospital. Yes, absolutely, it's absolutely different because we monitor all the factors for your sleep.
Yes.
Example, we monitor brainwave to see that how deep of your sleep.
Oh, I see.
We monitor the airflow come inside your nose, your mouth. Even you open the mouth, or we record the snoring sound. We record the heart rate. We record the oxygen inside your body. We observe the position that you sleep. We observe your legs that you're kicking or not. So, and finally, we use all information to calculate that how many times that you stop breathing or how low of the oxygen that you have. So it's like I can say that we can get comprehensive data of your sleep at night. And the one thing that I have to inform is no pain. So it just monitor. No electrical to your body, right?
That's the best. That's the best. So the suggestion is, if you have problem like drowsiness during the daytime, or feel weak, like you don't have enough sleep, but also snoring a lot, besides that, obesity. I touched myself. And what about the age? If you don't have that kind of problem, do we just come in for the sleep test as well? Can we?
Normally, the age is very wide range. It happens since you are child, children, young adult. But when you're getting older, it can be worse. So mostly have more symptoms when you're getting older. So wide variety of the age. Yeah.
Is that OSA or this sleep apnea problem can happen to the children as well?
Yeah.
Okay.
Yeah.
So either you're getting older, or you have the problem that we mentioned before. Yeah, you can come in for the sleep test.
Yeah.
But during this period of time, many people don't like to come into the hospital. Either because of lockdown or because of worry that coming into the hospital maybe not safe. But actually, I have to say it's very safe to be here. I'm so happy to come, because even our staff, thousands of staff, we are safe here. The cleanliness is the best here. But if you worry about coming into the hospital, is there any option?
We still have home sleep test also.
Yeah.
But home sleep test is not equal to sleep overnight here. But even in this situation, or in high risk, we call high suspicious patient, like have the symptom that we talk together, and would like to do it at home, we still have home sleep test. So when you get the machine, you just put it on your body. And
there is a technician come along with the machine?
No, we have someone to deliver to your home. Or you can pick up, you can collect it at the hospital and do it at home.
There is an option.
Yeah, the benefit is you can sleep in the same environment at home. Because many patients, 10% of the patients, do a sleep test here. Cannot sleep.
Feeling better to do it at home, right?
Yeah.
Okay.
So, but the limitation is like because of less monitor when compared to inside the hospital test. So it's just like screening test. So I would say like a home sleep test is easy. It's convenient. You just do it at home, and you can send you can see the result by like screening test.
By ourselves, or
we send by email.
I see.
But if like to talk together, we can put a tele consultation also.
I see.
So it means that you just sit at home, sleep not sit, sleep at home. Yeah. So, just
let me ask you, with the home sleep test, do I have to sleep alone? I mean, if the couple they want to do the test, they can continue their normal living, but have the sleep test done.
Yeah, you can sleep with the same situation, but just be careful that if your love or your bed partner snoring also, just that's it. But normally this design is like just do it at home, and we have the instruction to do it. Yeah.
I understand that. If you both snoring, then you both do the home sleep test.
Yeah, but normally, it can be done like that too.
Yeah. So if I'm thinking after I have got the test done and I have to use the machine, or what's the name of the machine that I have to use, like snorkeling gear. Because CPAP kind of, and I have to use it every night, but I feel like the next day I feel so fresh. Until I feel like without this machine, maybe I don't have the fresh air. Yeah, get used to it. At the beginning, let me share my experience. At the beginning, I feel like, how can I sleep with this kind of machine? the feeling is like at the beginning I used the seat belt in the car, but now when I don't use it, I feel like unsafe. It's not safe, and I make decision to get this machine after I got the suggestion from the doctor, because I feel like falling asleep and never wake up again is very scary, especially we have someone to take care and we are not ready yet to go.
Yeah.
Yeah, that's called that costs a, for me it costs a lot of money, but I think to continue living is more important. And I got the machine, and now I'm healthy and strong enough to work, to continue my normal living.
Yeah.
And now I heard from the doctor that it may also cause a lot of problem if I still have that problem but I don't fix it. So what kind of sickness may happen if I don't use the machine or I don't correct my sleeping habit?
Yeah, think about the same mechanism, because your airways become collapsed and open, collapse and open.
Oh.
So it means not enough oxygen inside your body and waking up many times.
Oh.
How the heart can be rest, how the brain can get deep sleep, because deep sleep is the one factor of the good memory. And deep sleep is still make you have enough attention in the daytime.
I see.
So it means that if you not get the treatment or you ignore, it's just there's nothing. So
I may
maybe
come to work like a zombie.
Yeah, you can have heart disease. Many patients ask me that if sleep apnea cause me death, can I sleep and death? I would say that in fact it's not death, but you can death from other disease.
Oh.
You can death from heart disease. You can death from stroke. You can death from high blood pressure. You can death from many diseases that happen later, even the accident. If you feel sleepy and you drive.
I got that. That day, that I only think that this may cause accident on the road, because I almost fall asleep. I almost caused an accident. So I make decision to come and consult and get the treatment done. But since you give me the series of sickness, so it's not just sleep problem.
Yeah.
It's not just a couple problem that you're snoring and annoying the other one who sleep next to you, but it can be killer.
It's impact to yourself.
Okay.
It's not just for other people beside you, right?
Yes.
Yeah. Because most of the people come to see me because of his wife brought the husband to see the doctor, but it's not just that one, right?
Okay.
Yeah, and many when after the patient get the treatment, some people can say that this one is the 33rd organ in your body.
Okay. The machine is the
because we can say it comes back to the mechanism of sleep apnea. It become from your airways become collapsed. So the machine is we call PAP machine. PAP is mean positive airway pressure machine. It's like a fan. Think like a fan. Fan blow the air, right?
Okay.
Normal air, like you sleep at night. Everyone sleep.
Okay.
So it's blow the air to open the airways.
Okay.
And you can sleep whole night long if you have sleep apnea.
And that's good for circulation.
Yeah.
Air circulation, blood circulation, oxygen circulation in the heart and the brain.
Yeah.
Okay. I mean, working hard in the daytime and taking good care of your heart and your brain in the nighttime. Okay. That's, I think if your loved one, your husband or your wife or your children talk to you that you should do the sleep test, don't get mad. Don't be angry. That means they love you and they want you to take care of yourself. And tomorrow is a special day in Bangkok Hospital Phuket. We are going to celebrate also our hospital birthday, and we are going to have like kind of promotion, that the sleep test can be done either in the hospital, but is there, or a home sleep test, but is there any special for us if we come into the hospital and we want to do the sleep test done? Do we have to prepare things ahead, make an appointment a month ahead, or how is it?
You mean like overnight sleep?
Yes,
here,
coming
right?
into the hospital.
Yeah, just like normally the queue is not too long like that. Just like you have to come to see me first.
Okay, consult with
Yeah.
Dr. Kanya first.
Yeah, like we because we have to talk and discuss in detail and have plan to do the sleep test. But the sleep test is quite easy. You just come to sleep like you sleep at home. It depends on what time that you sleep. Because many people in Phuket, especially in Phuket, like sleep in the day, work at night, or sleep at night, work in the day. So anytime that like usual sleep.
Or that
like
means if I work
sleep.
in the nighttime, I should make an appointment and I can do the sleep test in the daytime.
Yes.
As I always do at home.
Yeah.
Okay,
so
that's
just
kind of
come.
option again.
Yeah, just come and the technician will do the monitor, put the monitor to your body
I see.
and let you sleep. But if you in case of some if we monitor, sometimes we monitor like 3 to 4 hours.
I see.
And found that absolutely you have sleep apnea and it's severe. Sometimes we put the PAP therapy in that night.
And at the same night,
yeah.
And we can compare without the PAP and with the PAP, how is the quality of your sleeping time.
Yeah, and we can see that how much of the pressure that you use. This is the benefit that you do it inside the hospital. But as I told you, like some
not
people
just feel like
not like to come can do it at home too. Like we call like home sleep test, but okay, at least we can screening and we can see.
Yes. So the home sleep test, we also give them the instruction, right, when they are going when they are going out. Okay, and
but like, if someone cannot, example, they got all machine instruction already, still I cannot do it. We can put the video call to the staff at night. That is correct or not too.
Okay. So we will not leave you alone.
Yeah, but normally it's quite easy. It's very easy.
But if we miss the first night, is something gone wrong? Can we still do another test?
Yeah. Normally when we do the home sleep test, is a good question that is easy to follow, right? Yeah. So normally we have like 2 days to do it. If the first night it's not enough, then
I still have another chance.
To do it again. Yeah, but don't forget that home sleep test is just like the screening one. So it's less monitor, but still it's easy. It's easy and it's convenient at home.
Yeah. So if we can detect by doing the home sleep test, if we can detect that we have sleep apnea, so we also can start the treatment.
Yeah.
Okay.
Yeah.
Not painful.
Yeah.
Very convenient. And anytime, just come to see Dr. Kanya first and get the information. Then maybe you have to also discuss with her about your maybe chronic disease, chronic disease, and also the activities during the day, kind of what may lead you. Is there also any information about using some kind of medication for a long time and may cause this problem also?
Absolutely. Yeah, because of especially sleeping pill, alcohol. This one can worsen the condition of sleep apnea also. Yeah.
Okay.
Yeah. But for
I feel like now everyone should do the sleep test.
Yeah. But home sleep test is the other thing that is convenient, that because it's non-invasive. If you listen or you listen, maybe I have it, you can ask to do it at home. It's quite easy.
Is it possible to do like calling or telemedicine with you?
Yeah. We still have the telemedicine like program to talk together to make a plan. If you don't like to come to the hospital,
we are living on this planet now and doing kind of home test and also telemedicine. So like staying with us, and we so have so many options right now. For example, this webinar live, this TikTok live webinar, also one of the option that we would like to come into your house, into your place, into your workplace to share the information with you. And as I mentioned before, Dr. Kanya have explained a lot, giving us a lot of information, but I'm sure that you still have questions. If you have questions right now, you can text in and we will try to answer all questions you may have. But besides that, if you find out later, you also can communicate with us, because we also have our website, www.phukethospital.com, and also Facebook of Bangkok Hospital Phuket, English version, or coming up next will be also many different languages. And also call us directly to 1719, and that is the hotline of Bangkok Hospital Phuket, and get more information or get through to the Neurology Science Center, right? So what kind of question do we have right now? The first question is there, doctor.
Okay.
So we have to read it. And okay.
Yeah.
So let me read the question for you. For the past 2 years, I wake up about 3 times every night. Initially, it was to go to the toilet, but now I get up anyway, even not go to the toilet, right? Is there anything or any test I can do to determine what the problem might be?
Yeah, this is a common question. It's a very good question, because of that we talk together, that many people with sleep apnea coming to the hospital because
suffering
we call broken sleep, right? Like sleep and have to wake up, sleep and have to wake up. This is a one factor. But from this question, maybe we have to think other things too, like if you're a man, how about the problem with the urination or not? Yeah, or infection. We have to get physical examination in more detail. Yeah, but sleep apnea is the one cause of the symptom also. So any test that you can do it, normally, so we have to absolutely physical examination. And then maybe you have to do the urine exam, maybe we have to do the sleep test to see that what's wrong. It's come from because of urination,
the age,
or it's come from the sleep problem. Yeah.
Okay, I think the best way is like, maybe if you don't feel like to come in, telemedicine can help. Many different channels that you can contact us, or come into the hospital. And the next question is, now many people don't want to go to the hospital. Yes. But I have to come. I work here.
I have to come
okay. They don't want to come to the hospital during COVID period. So how can I have the sleep test done conveniently without going out from home, as you mentioned before?
Yeah. So in this one, we have home sleep test. Okay. It's not equal like overnight sleep test, but it can be the tool for screening that you sleep at home. So you just call to make the appointment to the hospital. They send this machine to your house. You just do it with the instruction. If you have any questions, you just video call to the technician here. You do monitor. Next morning, you return to the hospital. By how? Like my staff, you come to bring it back here.
It's like food delivery. Going directly to your place.
And then we can download data from the machine and send back to you by email. But if still have some questions or it's not enough, maybe we have to do something else.
Further investigation. I think the most difficult time doing the sleep test or home sleep test is making decision. Having sleeping problem is not kind of a little problem, but you sleeping every night. You sleep every night. And if you have problem every night, what may happen? Yes. And the next question, if I have to get the sleep test done at the hospital, how can I be sure about your safety measures to prevent COVID-19 infection?
Yeah, this is a popular issue right now. Yeah.
Okay.
Yeah. Normally, we call like a full night and split night study. It depends on full night is mean diagnosis. Like we do monitor all night long, wake up in the mornings, go back home, come to get result. And split night that I said that like do the test first, and then if you have severe sleep apnea, we give you to try the PAP therapy.
Yes.
In case of full night study, we have like a standard, like a COVID protocol. Like the technician use the glove
To do the test, the COVID test before getting the sleep test done, right?
Yeah. Like normally at that night that we do the sleep test, we have the same standard hospital protocol. Like we clean, staff wear the PPE, whole body, to do it. Yeah, and everything clean.
Yeah.
Like a hospital standard. But if we have to do the split night study, or maybe we right now we will test like a COVID infection before.
Okay.
Yeah. So it's like we have standard cleanliness protocol to do it here.
Yes. I think I have to say, since I observe coming into the hospital, I see every 15-20 minutes, every 30 minutes, our staff will do the cleanliness, and actually in our website we also having kind of information about how do we take care of the hospital. I don't say cleanliness, but I say hygiene. Yeah, and top quality. Or like why I feel safer to come into the hospital, better than stay at home. with the bacteria. Okay, so the next question, home sleep test. Can this be used if you are a side sleeper?
Yeah. But home sleep test that normally when we monitor airflow, we monitor belt to see that how we call effort to breathe. We monitor oxygen inside your body. We monitor heart rate. So for this one, even you side sleeper, you prone sleeper, you stomach sleeper, you supine sleeper, we can get the information. But because most of the people with sleep apnea have more severe when you lying down on your back.
I see.
So sometimes if you side sleeper and you do it at home, you do home sleep test at home, and maybe turn to be like normal, it doesn't mean you don't have sleep apnea, right? Yes. Yeah, but because home sleep test is quite easy, but have some limitation.
Okay.
Because, but if if you side sleeper, you sleep on your side, and the machine monitor that you still have severe sleep apnea.
Oh,
it means if you even lie down on your back, maybe more severe.
Yes.
Right? This one home sleep test can give you a diagnosis also.
I feel like the other question should be like, who should not do this kind of sleep test? Because but it's very important, and since I'm the patient, I'm using this machine, I feel okay every day working 10 hours long, or even activity after work, still fresh, still can continue. But how often that I have to come back to you, and maybe if you say getting older, getting worse, how often should I come back to you and observe my sleep habit?
Yeah, normally if you're quite good doing well with the machine, normally we do monitor to check maybe the first 1 or 2 weeks after you use it, and then a bit longer to 1 to 2 months, a bit longer 2 to 3 months, and normally if I would recommend like every 6 months.
I see.
To check, to download the data, to check everything that's still okay or not.
I like it very much, because in the past time we are living with feeling, thinking, but right now everything is evidence-based. We can get exactly the information, what we have, what we are facing, and we can fix that problem with the science.
Yeah.
That's why we have Neurology Science Center to get things checked and fixed, and also maintain the good side. And I think from now on we are going to have like quality time. It doesn't matter how long you sleep, but the matter is how long is your quality time of sleeping, right? Okay, so as I mentioned before, we are here every day. The center is open every day, and you can reach us if you want to get more information about either the sleep test or problem that relate on Dr. Kanya department, or other questions about the health. You can also contact us at 1719 hotline of Bangkok Hospital Phuket, or visit our website www.phukethospital.com, our Facebook of Bangkok Hospital Phuket. We have like Thai version, English version. There are many family that we're bilingual. Yeah, and if you don't want to come into the hospital yet, Dr. Kanya already told you that telemedicine is an option, and home sleep test is also an option. And tomorrow is a good day. We are going to have the special promotion. Don't be surprised, because in our hallway in Bangkok Hospital Phuket, we are going to have again the promotion period that we celebrate our birth month of the hospital. And I think every year, once a year, that we get a very special promotion. And I think nowadays the health is very important, right?
Including sleep health also.
Okay, yeah, okay, because like we don't know what may happen again, what coming up next, or new version of virus maybe. If we stay healthy, then we can fight for everything. Okay, so thank you very much. Thank you, Dr. Kanya. And thank you all the audience. If you have another questions, more questions, please feel free to send us an email or give us a call. Thank you so much, and stay tuned next Thursday, 2 o'clock. And we are going to talk about our spine. Let's see again next week. Thank you. ขอบคุณค่ะ